Hey guys, Adam with Behm Muscle and Joint Clinic. We got Katie with us today, and we're going to go over tri-planar stretching, specifically for the hip flexor. So tri-planar stretches are something that we do in the clinic pretty regularly. It's a way to stretch the muscle in all three planes of motion. So a muscle should be able to go, a joint muscle should be able to go through three planes of motion: forward and backwards, side to side, and then lateral bending from side to side. Hip flexors are very commonly tight. So we live in a society now where we're sitting constantly, and the hip flexor kind of brings our legs up, so that's essentially going to be tight whenever we're sitting all day. This is a good way to stretch that, as opposed to just boring kind of static stretching. So for Katie, we're actually stretching her right hip flexor, and then she's going to go through three motions with this. So to kind of start out with, we want Katie in a single leg kneeling position. And then I'm going to instruct her to kind of, if she has a tail, tuck her tail, so to speak. So she's going to kind of posteriorly pelvic tilt, and then we want her to lean forward. She should feel a stretch deep in the front of her hip. We don't want ballistic stretching, so we don't want really bouncing and leaning forward, back and forth. We just want her to lightly lean forward, no tipping of her torso, and then kind of hold that for a second or two, and then get out of it. So there's straightforward. Second one, you're going to go same thing, kind of tuck your tail, go forward, and then she's going to almost punch over her opposite knee. And you're always punching over the knee that's up, not the knee that's down. So here we're adding the rotational component, and then go ahead and come back out of that. And then the third one is she's going to do the side bending. So she's going to tuck her tail, lean forward, and then tip to the side. Good. And then if this is you that has the tight hip flexors, do this several times a day, both sides obviously, and that should really loosen up the front of your hip.